Hey guys, this is Brandon McCatherine with 10th Planet Jiu Jitsu in Decatur, Alabama. I'm joined by Dr. Michael Cantrell. He's a sports and orthopedic surgeon in Huntsville, Alabama. We're going to talk to you today about the inverted heel hook, specifically from the 50-50 guard. Now, I'm not going to go through teaching you how to do it because you already know how. But what we do want to do is have Dr. Cantrell explain to us what's happening during the lock and how we can apply the lock more efficiently. All right? So here's the heel hook from the 50-50. Here, here, and I go back, and then a small rotation that way usually gets the finish.
Yeah, so what's happening here is two things. The main thing is that the rotational or torque moment to the knee, which will tear the ligaments right in the center on the inside, most likely the ACL. And then the second, smaller thing appears to be a valgus force, which is a force that would tend to bring the knee like this, and that'll tear the ligament right here, which is the MCL.
And so, for me, if I can get him extended here, the lock is much tighter, and then it's the rotation at the end is what gives the kill.
Right.
But a lot of times when you go, like, for instance, there's an injury that I'll do where I'll end up kind of in this position here with it, the leg bent more dramatically and the angle changed. When that happens, I know the damage is the same, but what's the most optimum, like what's the perfect angle to have the leg at to get the kill that I'm looking for?
Probably 30 degrees of flexion or somewhere between 15 and 45. Another thing you'll note is that with his knee flexed a little bit more, he seems to be able to just let his hip rotate some, which kind of takes that pressure off.
For sure. But I know when we had talked about the standard heel hook earlier, you had said, and my experience also is that if the leg is straight, then it's more difficult to apply the lock. But if we could find a way to apply the lock with the leg straight, that there'd be much more damage done. Is that correct? True in this position as well?
Exactly, because with the knee about 30 degrees of flexion, most of the pressure is directly on the ACL itself and perhaps the MCL. But when it's straight, there's a lot of bony geometry that helps hold it stiff. And if you have enough force to pass through that, it's going to tear more of the ligaments.
Okay, so say a position like this, then, is going to be just devastating to the knee.
Mm-hmm. That's right.
Awesome. That's what we need to know. How can I snap this guy's leg better?